When performed accurately, aseptic technique minimizes contamination and spills. In this section, we'll review the proper handling and use of needles, syringes, and filters. First, let's discuss needles. There are three main parts of a needle: the shaft, the hub, and the bevel. The shaft is usually metal and lubricated with a sterile silicone coating. The larger end is called the hub. The hub attaches the needle to the syringe and is often color-coded to designate the needle's diameter, or gauge. We'll discuss gauge in a moment. Notice how the tip of the needle shaft is slanted to form a point. The slant is called the bevel, and the point is called the bevel tip. The opposite end of the slant is called the bevel heel. Needles are commercially available in many sizes, described by two numbers: gauge and length. The gauge of the needle corresponds to the diameter of its bore, which is the diameter of the inside of the shaft. The larger the gauge, the smaller the needle bore. For example, the smallest needles have a gauge of 30, while the largest needles have a gauge of 13. The length of a needle shaft is measured in inches and usually ranges from 3/8 of an inch to 3.5 inches. Some needles are designed with unique characteristics. For example, needles for batch filling have built-in vents to release pressure that might form in the vial. Another unique design equips needles with built-in filters intended for products or preparations requiring frequent filtering. In order to open needle packages correctly, follow these steps. Position the packaged needle 6 inches inside the hood without blocking airflow. Tilt the needle hub toward the back wall of the hood to make sure the airflow is surrounding the needle. Hold the needle in the middle of the cap and pull packaging from the top toward you. Make sure you never touch the shaft that will be in contact with the drug. Then, without moving the needle outside of the hooded area, discard the packaging into the waste container beside the workstation. When dealing with small volumes, it is important to account for the volume of the solution left in the hub of the needle. It may be necessary to dilute the product to increase volume or provide overfill. Consult the institution's policies and procedures for guidance. Next, let's talk about syringes. Syringes are made of either glass or plastic. Some medications react with plastic, potentially altering the potency or stability of the final preparation, so glass syringes are used for some drugs. However, disposable plastic syringes are most frequently used in preparing sterile preparations because they are inexpensive, durable, and are usually in contact with substances only for a short time. Your institution will have a clear policy on which syringes are used with which drugs. Composed of a barrel and plunger, syringes provide the suction power to both draw in and expel fluid through an attached needle. The barrel holds the drug. The plunger provides the pressure. The plunger fits inside the barrel and has a flat lip at one end and a rubber piston at the other. The top collar of the barrel prevents the syringe from slipping during manipulation. The tip is where the solution is drawn in and ejected from, and where the needle or other attachment is made. To maintain sterility of the preparation, do not touch the tip of the syringe or the plunger. Many syringes have a locking mechanism at the tip, such as the lure lock, which secures the needle within a threaded ring. Some syringes, such as the slip-tip syringes, do not have a locking mechanism. In that case, friction holds the needle on the syringe. Syringes are available in numerous sizes, ranging from 0.5 to 60 milliliters. Graduated marks on the outside of the syringe barrel represent different increments of capacity, depending on the size of the syringe. Notice the measures on the side of the large syringe in comparison to a small one. You can see that the volume of the liquid held between the markings in the small syringe is much less than the volume of liquid held in the larger syringe. Usually, the larger the syringe capacity is, the larger the interval between graduation lines. For example, each line on the 10 milliliter syringes represents 0.2 milliliters, but each line on the 30 milliliter syringes represents 1 milliliter. Syringes are accurate to 1/2 of the smallest increment marking on the barrel. For example, a 10 milliliter syringe with 0.2 milliliter markings is accurate to 0.1 milliliters and can be used to measure 3.1 milliliters accurately. A 30 milliliter syringe with 1 milliliter markings, however, is only accurate to 0.5 milliliters and should not be used to measure a volume of 3.1 milliliters. Ideally, the volume of solution should take up only 1/2 to 2/3 of the syringe capacity, which avoids inadvertent touch contamination caused when the syringe plunger is pulled all the way back. When measuring with a syringe, the final edge of the plunger piston should be lined up to the graduation mark on the barrel that corresponds to the required volume. For maximum accuracy, the smallest syringe that can hold the required amount of solution should be used. Syringes are packaged to keep them sterile and ready for safe use. The sterility of the contents is guaranteed as long as the outer package remains intact. Therefore, packages should be inspected, and if found to be damaged, discarded immediately. In order to maintain sterility, the syringe package should be opened within the hood. If you are working with syringes in an isolator, there are a few things to keep in mind. If the syringe does not have a protective cap, the package should be opened inside the isolator. Otherwise, the outer packaging should be peeled apart inside the antechamber, not ripped or torn, to minimize the introduction of particles. Syringes may come from the manufacturer with a needle attached or with a protective cover over the syringe tip. The syringe tip protector should be left in place until it is time to attach the needle. For attaching needles to lure lock type syringes, a quarter turn is usually sufficient to secure the needle to the syringe. As you are setting out your supplies before compounding, inspect the needle package to make sure it is not opened or damaged. A damaged package should be thrown in the special sharps container, reserved for needles and syringes. Let's discuss the standard procedure for opening a syringe. Without blocking airflow, place the syringe 6 inches inside the hood workspace and remove the package. Hold syringe by the barrel, never by the lure lock, tip, or plunger. Angle the barrel tip toward the back wall of the hood and the flowing air. Grasp the top of the packaging with the other hand. Peel the packaging down from the tip and discard wrap in the waste container beside the workstation. Do not use the same syringe more than 5 times for a single compounded dose. Choose the appropriate needle for the syringe by comparing the needle size in relation to the size of the syringe. Usually, these rules apply. When using a 1 milliliter, 3 milliliter, or 5 milliliter syringe, use a 20 gauge, 1-inch needle. When using a 10, 20, 30, or 60 milliliter syringe, use an 18 gauge, 1.5-inch needle or admixture needle. When compounding large volumes or viscous drugs, use a 16 gauge, 1.5-inch needle. When compounding requires the contents of a glass ampule, use a filter needle. Please note that the use of large gauge needles may present the risk of coring. The increased diameter of the needle increases the risk of slicing, or coring off a portion of the container's stopper membrane. Whenever you use a large gauge or admixture needle, be sure to inspect the solution container at eye level for debris that could have been pushed inside the container. Undetected particles left in the solution due to coring cause contamination of the sterile compound, which can be detrimental or even fatal to the patient. Let's discuss how to connect needles to syringes. Place the packaged needle and packaged syringe at the correct location under the hood to ensure proper airflow for the sterile environment. Point the needle and syringe toward the back wall of the hood where air flows. Place the needle and syringe at least 6 inches inside the hood at the center of the work surface. Position hands so as not to block airflow. Remove the packaging from the needle inside the hooded workspace. Keep hands angled to the side in front of items that will be manipulated to keep the airflow from the back wall blowing freely toward the needle and syringe. Hold the needle at midpoint on top of the packaging. Pull the packaging down from the top to the center toward you. Hold the needle by the capped area only. Lay the capped, unwrapped needle pointing toward the back wall. Discard the needle wrapper in the workstation's waste container. Now, remove the syringe from the package 6 inches inside the hooded workspace without blocking airflow. Hold the syringe by the barrel. Tilt the barrel tip toward the back wall of the hood where air is flowing. Grasp the top of the packaging with the other hand. Peel the packaging down from the top and angle toward you. Discard the wrapper in the waste container beside the workstation. Attach the needle to the syringe 6 inches inside the hood without blocking airflow. Keep the syringe in one hand and point the tip toward the back wall where airflow originates. With the other hand, pick up the needle at the midsection of the needle cap. Insert the needle hub onto the tip of the syringe, being careful to position both hands away from airflow. The needle may be held on by friction or by a locking mechanism. The fingers should be held well back from the point of the needle syringe attachment. Pull the cap straight off. Then lay the cap inside the hooded workspace with the opening facing the back wall until it is needed to recap the needle for disposal. Now let's talk a little about working with syringes and needles. One of the most common problems encountered when withdrawing medication from a container is that air bubbles may also be drawn into the syringe, preventing accurate measurement of the solution. To remove air bubbles, hold the syringe in a vertical position so that the needle is pointing upward. Pull the plunger back a short distance so that some air enters the syringe and solution is drawn in from the needle. Firmly tap the barrel of the syringe so that air bubbles clinging to the side float to the top of the syringe. Expel all the air in the syringe by slowly pushing in the plunger until the solution fully primes the attached needle. Then, read the volume of solution by aligning the pointed end of the plunger with the graduation marks on the barrel of the syringe. Syringes and uncapped needles should be discarded in puncture-resistant sealable containers, often called Sharps containers. If the pharmacist needs the syringe to verify the amount of drug added to the admixture, institutions may allow needles used in compounding to be recapped for removal and disposal. When a syringe is used to verify the amount of drug added, the plunger is drawn back to the graduation mark to indicate amount and, along with the drug, placed next to the completed and labeled preparation for the pharmacist to verify. As required by OSHA and the CDC, most institutions have policies against recapping needles to decrease the risk of needle stick injuries. Contaminated, uncapped needles and syringes must be disposed of in puncture-resistant containers. If recapping is required, a one-handed scoop method should be used. For worker safety, two-handed recapping is never an acceptable practice. Let's discuss the precautions for safely recapping and discarding a used needle and syringe. Position the syringe cap on the hood's work surface at a left-right angle so that the needle can slip inside without hands blocking airflow coming from the back wall of the hood. Remove your hand from the positioned cap. Using the one-handed method, aim the needle toward the opening of the cap and move the needle inside. Now, using your other hand, hold the cap and continue moving the needle cap opening toward the needle hub. Twist the cap on the hub sharply to lock in place. Remove the used recap needle on the syringe. Then, dispose of the cap needle in the Sharps container or save to be placed in a bin for the pharmacist to check later. These procedures help to guard you against injuries, such as needle sticks. There are two types of needle sticks: when the needle has never been used and when the needle has been used for compounding or to inject drugs into a patient. Both accidents need to be reported. OSHA requires that everyone be aware of the proper procedure in case of needle stick accidents. If the injury is from an unused needle, inform a manager within 24 hours of the incident. Complete a record of occupational injury illness. Have the injury examined by qualified medical personnel. If the injury is from a used needle, inform a manager immediately. Complete a record of occupational injury illness form. Have the injury examined by qualified medical personnel. If recommended, return for a follow-up visit. Remember, it is your responsibility to report such incidents to your employer. Proper aseptic technique is an acquired skill. Pharmacists and technicians must be trained and demonstrate competence in aseptic technique before they are allowed to work in a compounding environment. Some of the most common manipulations that you perform in compounding involve syringes. Just as safe technique can prevent needle stick injuries, proper aseptic technique is one of the most effective ways to minimize the risk of exposing the preparation to microorganisms.